I think it's pretty much it. You have covered it all because whenever a person gets some sort of cholesterol levels, it's shooting up. It's very likely for them to get heart-related diseases, no doctor. Like if it's not under the control.
Yeah.
So it's directly there's an extent to which it can get transition to heart diseases, or people who are having diabetes and cholesterol are prone to heart. Like how does this work? What is the connection between this and
If you
heart?
ask me, I can only say that
Yeah.
in olden days, people were actually getting problems of infectious disease like typhoid, cholera. All other infections were actually taking the lives of those patients in the past. But now our country is burdened with non-communicable disease.
Okay.
One of the non-communicable disease is diabetes. Yet another non-communicable disease is hypertension. Yet another problem is the lipid abnormalities of the cholesterol. These are the non-communicable disease which is taking a bigger role in pushing patients for one heart attack to stroke events. How this occurs? Diabetes as such can affect the smaller blood vessels which are growing through the retina or the eyes, which can precipitate what is called as diabetic retinopathy. The patients may become blind if they don't get into consultations with the doctor. The second one, which can affect the smaller blood vessels, is at the level of the kidney. If it starts affecting, it is called diabetic nephropathy. Ultimately, the kidneys will fail. The patients will land up only with the kidney doctor, going in for one dialysis or for kidney transplantation. The other smaller blood vessels which can get affected is at the levels of the smaller nerves, which we call as the peripheral neuropathy. So diabetic peripheral neuropathy. These are all the smaller blood vessels which can get affected as a result of increased blood sugar levels. The increased blood sugar levels not only affect the smaller blood vessels but also the bigger ones. The bigger ones in the form of the blood vessels which are going to the brain can get affected. The blood vessels which are going to the heart can get affected. The blood vessels which are going to the limbs can get affected. So patients will land with a stroke, can land with a heart attack, can land with the problems of the insufficiency of blood circulation to the food, and ultimately they get into problems of diabetic foot infection. They may even go for amputations.
Okay.
So these are all things now which can occur. So one, smaller blood vessel complication, larger blood vessel complications are commonly seen in those people with diabetes. At the same time, those people with these problems can also get into yet another condition in the heart, where the heart muscles actually become damaged as a result of ongoing diabetes, which is called as a diabetic cardiomyopathy.
Okay.
ஸோ தமிழில் நான் சொல்லணும்னு விரும்பினா, சர்க்கரை வியாதி உடம்புல தலைமுடியிலிருந்து கால் நகம் வரைக்கும் பாதிக்கும் அப்படின்னு சொன்னேன்னா நான் தப்பே பண்ணலை. நீங்கள் தெரிஞ்சிக்க வேண்டிய ஒரு உண்மையை நான் சொல்கிறேன்றதை தயவு செய்து மனதில் வச்சுக்கோங்க.